Hi everyone, and welcome to the NG Podcast. I'm Marcus Einson, your host. In the NG Podcast, we hope to bring you content that's of interest to anyone involved in enteral feeding, whether you're a healthcare professional, a patient, or a carer. We hope you enjoy this episode, and if you do, please subscribe or like on whichever platform you're either viewing or listening to this on. Here we go. This week, we'll discuss a hot topic for many NHS organisations, implementing electronic patient record systems. Still, being the NG podcast, we're looking at this from a nutritional angle. To help us do this, I'm joined by Georgie Adams, the lead clinical nurse specialist for nutrition support and intestinal failure at Royal Devon and Exeter NHS Foundation Trust. And as if that doesn't keep her busy enough, Georgie is also the Communication and Media Officer for the National Nutritional Nurses Group, the NNNG. Georgie, welcome to the NG podcast.
Oh, many thanks for inviting me, Marcus. It's a pleasure to be here. I'm really keen that we can share the work that we've been doing here in Exeter, certainly to date, because it's still very new for us, EPIC. But how we've been using some of the systems to develop and maintain patient safety and quality care.
Excellent. Well, I think that's definitely what we wanted to explore. And, I guess we invited you to come and talk about this because you have really recent experience of implementing an electronic patient record system. But before we talk about the opportunities and hurdles from a nutritional perspective, how did you feel when the decision was made to start the transition in your trust?
Yeah, I mean, the transition began some 2 years before. So we had very early announcements that the RD&E Acute and Community Trust would be implementing EPIC. We all understood it as a digitalised computer system so that all systems would be in one area on a computer. But as with any change, the unknown and uncertain really does provide a certain sense of foreboding. And I think that was true of all of us, however much experience you may have with tech and IT. And it wasn't any particular staff group. It was all of us that felt the same. So there's lots of whys, whats, whens, what could we expect? The very thought that it was going to be a whole system digitalisation could feel quite overwhelming. And inevitably, there were all those questions. What if it crashes? What if we have a cyber attack? And what about patient confidentiality? So all the standard questions and concerns were raised at that time. And I think that was good because there was lots of audience, lots of opportunities to talk that out, but also know that there were many other systems in the country and acute centres, community areas that were using this. In fact, we were the first area to use a community system. So we had lots of others that we could follow. And clearly it's an American system, and the American teams were coming over, the US teams were coming over to work with our specialist teams.
Okay, so I guess I've done some electronic patient record systems in other organisations, and I guess whether I'm right or not, I always think of you as very organised and detail conscious. So I think the preparation to move to an electronic system for you would have been relatively straightforward, but was that the case?
Well, I would say that's a good interpretation of my character, Marcus, yes. 34 years of acute nursing, 25 of which have been spent in managerial leadership roles. Inevitably, I'm relatively confident in new work streams and how to work those through. But variety is the game here, and clearly we were all going to have to take quite a leap of faith if we were all going to go together. And I think that's the important thing, that we were going as an acute trust, all disciplines, regardless of your experience. So we had an EPIC webpage, a very quick team were brought together for the initial announcements, and it was very much driven by the chief executive and now the chief medical officer. We had weekly updates, lots of meetings, and then big team were put together. So lots of secondments, lots of people going out for new roles and opportunities. So that in itself was very good because it was all homegrown, lots of recruitment, lots of energy. And I think that's important when you've got people that are being seconded out of clinical, administration, facilities. They're all going together. And so you get to hear a lot of that conversation. We then were told that we would need to have subject specialists. So, for example, we had clinical staff coming through from gastroenterology who would then act on behalf of the other specialities. And super users, there's going to be a lot of terminology that I'm going to be using. And to be honest, we were all quite overwhelmed by that. What on earth is all this about? You know, sort of this whole cyber world being landed on us. But just take a step back from that because you can be put off by it, but you become more familiar with it the more you work with it. So we knew that Epic had launched and was working very well in Addenbrooke's. We also knew that UCLH in London were using it very effectively. And Gosh was the most recent prior to us.
Yeah.
And so that was great because they were going to a lot of presentations in those areas. The staff that were being appointed were going over to Chicago to actually look at the systems. The chief nurse at the time went and walked around in wards and understood how it was being used and how effectively it could benefit us all, not least saving time, of course. That was going to be the crucial bit and how we were going to use that time. So a huge team, lots of different roles, lots of different conversations and communication. And our intraweb was full of Epic and it was all over our screensavers. You couldn't get away from it. So whether you wanted it or not, it was there. And it was very much a drip feed approach for that first year.
Yeah. Yeah.
However,
it's not called Epic for nothing, is it?
No, it certainly isn't. So obviously, you know, everything seemed quite straightforward at that point. We were going along quite nicely. Lots of structure, personnel and communication. Great for change. So we all felt, you know, I think as we started to move through into 2020, because we knew we were going to launch in June 2020, the emails were coming in thick and fast. And at times it did feel that you couldn't open your email without a big drop down of Epic emails. However, I guess that has to be because there was so much information. They were trying to give it to you in bite size. So all was well, of course, until March the 23rd, 2020. And then, of course, as we know, the NHS changed phenomenally and beyond recognition. And COVID arrived and everything changed. We'd already started a lot of our planning and communication in the January. So it didn't come as a surprise. But as you can imagine, what was Epic suddenly was moved to a side because now all conversations were around managing the pandemic and all the wholesale changes that brought, not least that we all had to move to virtual technology. We were all socially distancing, people working from home, offices were having to be broken down so staff couldn't all be together, and they wanted to reduce footfall into the acute area. So you were only going for target visits. Yeah. At that point, all the staff that had been seconded to Epic had to return to their clinical roles. That went without saying. And so we worked through the pandemic and then summer arrived last year. And there was a time for some reflection and recovery. We were not affected in the same way, perhaps, that the rest of the country, certainly in central England, southeast and the northern parts of England. Devon and Cornwall had had a relatively stable period of COVID. Yes, we'd had some responses, but nowhere near to the extent I think the rest of the country had. So we were starting to, however, see come September a rise in staff absence, mostly isolation and some positive cases. And that had a huge impact on what we could deliver and provide. It was at that point that the chief executive and chief medical officer decided that this was now the time for Epic. Yeah. So we thought that it had been put back for a year, although we knew that we were due to launch in the June just past. However, they could see the benefits. They could see that we needed to really sort out. So, you know, we'd done what the rest of the NHS had done and become very, very competent at IT by then. And I think they went with the momentum and decided, let's go for this. We've really got to implement EPIC because it's really going to help us through the winter pressure and the increasing presence of COVID in the southwest. And so that happened on the 10th of October at 5 o'clock in the morning. The chief executive, the chief executive and chief medical officer pressed the button. Woohoo. Big social platform launch, and lots of people were awake all night. But a phenomenal effort. You cannot take away the effort. It was a big team effort. Because, of course, you have to bring over all the hard copy notes. They all have to be saved and brought into the digital world. So many volunteers came in, so many staff, retired came in, which was fantastic, all part of this big brigade to bring us to the point where we could launch EPIC. We all recognised the importance for it. It was just, are we ready now, given we're about to go through? And of course we did, as the rest of the country did, second wave and third wave. But it was so the right thing. And although it was a bumpy ride in, because of course everything had to be escalated at speed in terms of training, exposure, it was the right thing. When is the right time to do this? It's such a massive change. And I think the vision was, let's go with the momentum. There's been so much change. Let's stay with it.
Yeah, I think that's a tremendous leadership decision. And I agree, because if you actually wait until everybody thinks you're ready to do this, you never do it, because you just have to pick a time and dive in. So kudos to the senior management at your trust. Now, looking back with hindsight and how you prepared, apart from don't try and launch it in the middle of a pandemic, have you got any other tips for other people who haven't yet been through the process about that preparation period, maybe specifically?
Yes. Yeah, I think so many people, including myself for some aspects of it, got very intimidated by its launch, because you think you never know enough, and you know that that's the one thing that you have to work with all day, and you're completely dependent on it. So I would say, we're all very used now to getting new iPhones, analog phones. We've all got those iPads, new smart TVs, all the new tech that we're exposed to. This is no different. We've all got to learn to live with it and work with it. And we were told right from the outset, if you can work with social media platforms, search engines, you can do online shopping. And clearly by the time we got to August, September, October last year, we were all virtual and online frenzy. Then why would EPIC be any different? And I think that was probably a very good approach to take. So preparation is key, as with any change. However, I think you can overthink and overplan, because you can't overcome every eventuality. You have to work with the system. So accept that when you go live, it's going to be a standard structure. So you have 3 months where they want you to work with the systems, become familiar, become accustomed, really know that system before you start wanting to optimize. And I think that's good advice. It didn't feel it at the time, but looking back now, because otherwise you can change for change's sake. And there's so much change that has to take place. Your initial instinct is to convert paper to screen. And I think everyone would say that. It's not a straightforward conversion. How can it be? But actually, if you do take a step back, you suddenly realise that probably a lot of the paper trails were not always beneficial, were very labour intensive, and offered you so many other issues around governance. So stepping back, recognising what the digital system can do for you is really important, because once you start to become familiar and work with it, you can then style it in such a way that it's very, very user-friendly and it's slick. However, let's not forget, if you haven't documented it, then you haven't done it. And that doesn't change, whether you're digital or paper. And that's the important bit there. However, clearly audit trails, evidence base, and pathways, they are the future. That's what we work with. And that's what you have in EPIC. Subject specialists were really key to the change. One size doesn't fit all. I've just said we had a standard. You've got to start somewhere. We didn't have one. We had obviously just a generic gastro. On hindsight, we should have had one for gastro spec nurses, because I think the work that we do is so specialist and very different from the ward-based work. However, it is about having a voice, collaborating, communicating. And I did work really closely with the clinical documentation team who were all nurses. And also we have information officers who are very senior nurses. So they have a huge appreciation of what you're wanting and understand the terminology. And remember it's American. So you're going to have a lot of terminology. So flow sheets, avatar, orders, chart reviews. It's American. So initially you're quite overwhelmed with that. Step back, it is what it is, and you will become used to it. It happens naturally. Training was very fast and furious. It wasn't planned that way, of course. So we had lots of online learning to do, and then we went in for one face-to-face. So there's a lot going on. It's a busy time. Everyone is moving towards that. And we had clocks that were put on massive screens all over the trust. So we knew when launch date was, the time, the minute. So everybody knew. Everyone had to buy into it.
Yeah. Did anybody refer to those as doomsday clocks?
No, a lot of the patients and the relatives, because this was pre-pandemic, they all thought that was the waiting time for ED.
Might not have been that wrong at times.
Yeah, that was quite amazing.
Yeah, so you've been through all that preparation, and like you said, you talked about what happened on Go Live Day. What was it like in the period immediately after starting the new system? And again, are there any other suggestions you have that might help people prepare for day one and maybe week one?
So they launched 5 a.m. on Sunday morning. So there was a very clear cutoff in terms of the systems that we were using, very clunky or protracted and separate, straight into Epic when that button was pushed. The night staff was so well prepared. They had extra staff on so that they could all be prepared for that. So those of us that work Monday to Friday, we had that to look forward to on Monday morning, because you just don't know, has all the information come over and can I find it? So in I go Monday morning, prepared the team. We've all got our laminates so that, we've got our little user guides and our memoirs of how to work around the system. I thought we were all organised. And then at 9 o'clock, I get a bleep. Can I come to the emergency department, displace gastrostomy? Standard stuff after the weekend, nothing unusual there, except burning in the back of my mind, I've got to document this. So I go down, I do my work. As is always the case, it wasn't a straightforward. It took 2 hours to complete, and that's fine. That's standard. That wasn't the issue. But all the time I'm thinking, I've got to document this. I've got to document this. And everyone in the emergency department were all doing the same, working for the system. There were loads of people with high-vis jackets on with super user. They weren't all the RD&E staff. We had staff from London, America. So it was a phenomenal. I've never seen so many staff. And literally, I had a really nice lady from London, and she came and stood with me and facilitated so well and said, okay, what is it you want to do? I've just done a consult, and worked through it. And I tell you what, when you've done that, and it was so quick, and to find all the information about this patient in one area was just great. And at the end of it, and it didn't take very long at all, I felt you feel so good. You feel like, gosh, that's a real new skill here that I've done. And I've done this, and this has dropped down, and look at all this. So I was really delighted. Yeah, I felt comfortable with the navigation, but just making sure I was doing it in the right place. That was what I was most concerned about. So, I think that what you have to remember is it doesn't change your clinical work, does it? Obviously, like anyone, that very first time, you're thinking, I've got to document this. And please believe me, don't think that all of us didn't get frustrated and like, where's the paper? Oh, I need a pen. But no, stay with it. You've got great support around you. And actually seeing all the documentation there for the one patient was fantastic for me, because in effect it's a massive portal with lots of different information pathways in one area. You're not scouting around looking for different bits of paper and on different IT systems. How good is that?
And I guess, a few months down the line now, you don't have to look at dodgy doctors' writing and try and work out what it says anymore.
Exactly. Yeah. They obviously have their own signatures now on the documents, so we still see those. But no, you're right. Yeah. It's much clearer, templated, very logical system, and we're all using that as well as specialist nurses. Top tip, I think, practice. Practice makes perfect. You get lots of time before your live date where they'll let you into what they call an epic playground. So you get lots of opportunity and familiarise yourself, really. It's just being familiar, be familiar with the system, feel comfortable with it. You are never going to have a perfect setup. And that only happens when you work with it. I mean, I've got a very different template and profile to the ward nurses because they have a very different role to myself. So I have to look for very different information and set up very differently. So that was quite different when you look at their system to my system. Although it's there or thereabout, I've got lots more detail. And that becomes, someone wants to jump on. You can't. If someone wants to look at something you're looking at, it's like, that doesn't look like mine.
Yeah.
So
It's not
you have
supposed
to recognise. No, it's not meant to, because it's role specific. I mean, I work across the whole of the trust, both adult and paediatric. So the fact that I can go seamlessly between each patient and find that information, it's fantastic for me, because before I'd spend ages trying to find notes and clipboards and then to bed. And then you'd have to go onto a computer system to look back at the history. I mean, how much time must I have been using when actually my time should be at bedside talking with the patient? And that's the beauty of it. It prepares you. It gives you so much background and context. And I can do all of that before I get to the bedside. So I've already got a history, what's led up to the events often, and also I can look into community. Now, the GPs here don't have they can read it, but they can't actually put anything on it. That's to come. But I can see what all the community nurses have been doing, what all the social care staff have been doing, how many calls they've had. That is so useful to our work as nutrition nurses, because you can see if there's other social issues going on in the background that may have led up to certain events. Very, very useful.
Okay, so that's a really good point. Good point to jump off to the next question, because you talked about the benefits to the nutrition nursing team. So we've talked about the hurdles in the prep for implementing, but now you have it. Aside from what you've just already talked about, what are the benefits you're seeing as a nutrition nursing team?
Yeah, I mean, nutrition support teams are multidisciplinary. We're not a nursing team.
Okay.
So I can jump in and have a look at all the other disciplines. So if they're up on a ward round, I can jump in. If there's a phone call, or maybe one of the diagnostic services is phoning me about a patient that's up on a ward or due in that afternoon for clinic, I can jump in and see what my colleague, the dietitian, is planning or has done, what the pharmacist has prepared. And that is so useful to bring all that information together in one area. So that's saving an awful lot of time. Every Tuesday, we have a virtual feeding issues MDT, and that's acute and community. And all our new referrals have to come in through that route. It's led by our lead gastroenterologist. All the community team are there, and it's so important. So we can prepare all the agenda with all the notes and all the relevant area bits and pieces on that agenda. And we have one person presenting, one person taking notes, and we have someone else on Epic who can summarize various things. And, sometimes some of the specialists, if they're there, haven't looked back or need to look back at letters. It's all there. So there's not all this scrambling around looking for information. And I think that's phenomenal for clarity and accuracy.
Cool. And you've actually answered one of my other questions, which is about how's the MDT working changed because of the system. Is there anything else from that perspective that's been really useful? So
we have a WhatsApp bubble. So it's a secure, closed down NHS. It's only in Epic, but it's like WhatsApp, and we call it the bubble. And so throughout your working day, because you're all attached to your PC or your laptop, you can bubble each other. So if you're with a patient, I did it yesterday, and the patient's telling me, oh, the dietitian's organised this so that she's going to meet the family at 10. I said, oh, do you know who that is? Yes, it's so-and-so. But I didn't know anything about this, and I couldn't see any documentation. So I bubbled to her, yes, that's right. So I said, can I come along? Whereas normally you'd bleep, you'd phone, you'd have to wait for the bleep, you'd go on to another ward.
Yeah.
So it's really standardizing and streamlining everything. So everything's very immediate and responsive.
Yeah.
And what it's really good at, you can look at a note or a plan. And if you're unclear or unsure, then you can go straight into Bubble and say, can I just clarify? Were you aware of this? So I think the response and the timeliness is fantastic. I really do. And we also have a router, but that's becoming quite overwhelming because it's a lot of counter-signing of diagnostics. So we're trending to move away from that. You need something very responsive, don't you, when you're in the ward areas, in clinical areas, or on the move, as we are as a team, moving throughout the. And we often split up. So the dietitian and pharmacist will go in one way. As nurses, we'll go off and do other things. So it's great that we're always in contact. We've still got the bleep. We've still got the phone. We're not that far forward. But
haven't given them up yet.
No, not yet. No, not yet.
No, well, it's kind of, you would feel not dressed if you didn't have a bleep.
Yes. Yeah. We still have that. Yeah.
So I said at the beginning, obviously you're heavily involved in the NNNG. So putting your NNNG hat on, what do you think the opportunity for electronic patient records is for nutrition nursing, the nutrition support teams to maybe support and enable more uniform delivery of great care, wider than trust-wide, maybe nationally?
So if I just talk locally, the work that I've been doing at the moment with the clinical documentation and information officers has been around NGs. And that was always going to be the case. That was always my sole piece that I wanted to really do very early on. And we're almost 75% there now. And that's involved a big MDT as well, because we've had all the radiologists, radiographers, and all the administration teams in, so we can really get a good, strong, robust pathway. It has to deliver what the nursing staff on the front line and operationally are working with that level of risk. So that's been really useful. So you've still got exactly the same as you would have in your bundles, your care plans, but it's all electronic. So it makes it much easier to work with. Timelines, demographics, device choice, surveillance, maintenance, and the decision making. That's the bit I wanted to capture. We're also dropping down best evidence as well. So we drop down triggers to remind them, why would you do this? Maybe think about that. So we've got all the algorithms in there as well. So that's all come from NHS improvement, of course, patient safety. I think these pathways could very easily move over to become a national picture, which would align us to the HSIB reports and their recommendations, and also the BAPEN NG SIG arm putting the patient first. So all those recommendations that they talk about, the governance requirements, the standardization, the competency requirements around device choice and what the ancillaries you're using, that can all be brought together in one area, and we can standardize that. Now, obviously, I'm just starting very early in my trust, but I think long term, we can take that as a piece of NNNG work where we can start to lead from the front and actually start to present those pathways and start to roll them out across the country as a standard, because eventually the whole NHS will be EPIC, and therefore we can launch those pathways as part of the templates that each trust take forward. You can then start to measure performance. You can start to provide very consistent audit materials and really start to look at a far bigger picture than this happened in the Southwest or in the Northeast. That's not what this is about, because we are all experiencing risk. We're all working in isolation at times. And that level of vulnerability is felt wherever you work. So this is about bringing all that together. I'm not going to say any more because I plan to present more of this, probably with an article at our virtual conference at NNNG. But it's really to give a taste of where I think we could go in the future, and the NNNG can lead on that.
Okay, excellent. So I know prior to this call in the past, we've talked about you said you have access to some dashboards that you'd had built in in Epic that helps you monitor stuff. And you talked about measuring performance. So as a leader in the trust, how have you been able to customize those dashboards to what you want, and what sort of impact has it had so far?
Yeah, so I've got a list of all the patients, adult patients that have NGs. So anytime I can go into that list, jump into their profile, and I can look at the timeline of events. I can see how many times the tube has moved, been removed, replaced. I can look at the timings around that. I then compare that with the nursing notes and the activity that's gone on around it. Yeah. I can look at their surveillance and maintenance. So potentially, was the patient safe? Were they feeding appropriately? And the one thing for me is suboptimal feeding. So I'm always looking at hydration and nutrition and looking at the impact that's having on the patient and any new infections, so on and so forth. So that's a real sort of snapshot. I can go in and do that. Long term, the plan is that we always did quarterly audits anyway, and business intelligence did that for us. But it was always a very labour-intensive clipboard and pen activity. It still will be performed by the clinical nurse managers, ward sisters, charge nurses, because we really need to see ownership. But the templates will be there. The templates will set up, and they just drop in the information. They will get an instant report in terms of safety and requirement. I get that report, and then I can work with them around targeting education. And almost certainly we're going to see regular trends and patterns. That then informs my action to assure the trust, patient safety, mortality, nutrition steering, how I'm going to take that forward in a more robust way. So we provide 4 or 5 times a year care of patient NG workshops. We have NG champions, policies reviewed every 3 years, lots of resources. I can use that information then to inform that process. So I know I'm targeting the audience appropriately. I can't make any assumptions. I work with NGs all the time. I don't always feel or understand some of the vulnerabilities that are felt. And that's what I'm really interested in. How can I support the nursing workforce? Yeah.
So instead of trying to do a blanket approach, you can say, this is where I really need to focus for this issue, which is a fabulous tool ultimately for quality improvement, patient safety improvement. And it's great to see it starting to bite really early.
Yeah, definitely. And, we regularly get phone calls and bleeps. I can't get a pH. The radiologist has said I'm not to send the patient again for an X-ray, which is standard, of course, and so I can go in now and look at what they're looking at, right? Whereas before they would read the notes out to you, and some of it wasn't always, it was difficult to interpret on the phone. Whereas now I can jump in and look at what they're looking at. I can move around the system quite quickly because I know what information I want to look at. And I've done so much virtual coaching over the phone by doing that. So I can say, okay, tell me what you can see on that trend. What's happened in the last 24 hours? What's happened to the next measurement? Why did this happen? Why is the patient pulling this tube out? It's always when they need the toilet. So it's things like that. So that enables me to offer some real-time responsive coaching, not always at bedside, granted, but I can't be in all places at any one time. But I can offer that level of support, and they know they're going to get that support.
That's fantastic. So just thank you for going into all the detail on the electronic patient record. Just jumping onto a bit more onto the NNNG. You mentioned a virtual conference. The last couple of years, we've missed the in-person conferences. There was a successful virtual week last week. What are the plans for this year, and how can people get involved?
Yeah, we had a fantastic virtual conference last autumn. And it surpassed our expectations, if I'm honest. We had a massive sign up for it. It was free. And very well sponsored, for which we're very grateful from industry, to allow the opportunity to the community to come together. Nurses like to network. They like to come together and share and compare. And it's an opportunity for them to come out from some very stressful environments. So we really do try and make it very special for them. So how could we do that virtually? And we had sign-ups from Canada, the US, which we would never have had, of course, if we'd met face-to-face. So this year we are repeating, of course. We weren't keen to move nurses across the country. At that point, when we were planning at the beginning of the year, it was unclear where we would be in the autumn. But we thought, let's just accept pandemics don't just finish like that.
Yeah.
So let's prepare. Yeah. It's not appropriate to start moving healthcare staff. But more importantly, we knew that given there was so much restriction last year, nurses would want to be with their friends and family. So let's give them something virtual. So we're running it again this year, the 20th to the 24th. It's free sign up to all NNNG members and health professionals. 6 to 7, there will be a dedicated presentation slot. We're looking at a real diverse range. We're trying to look at all those difficult and challenging questions and subject matters that some of us come across, some of us don't, but may potentially. And that's the beauty of nutrition, of course. It's so diverse. We're also going to have a virtual nutrition village, which will be presented by industry, because we're mindful that none of the reps, none of the companies have been able to come in, and relationships have been affected by that. And I know we can do a lot by video and virtual, but nonetheless, we want to give people the platform. So there's going to be a real opportunity there, and we know that there's good evidence that it works. And we're sort of really thinking out the box and thinking about some really good presentations that can bring the audience together and get that camaraderie. So lots of flyers have gone out. It's gone out in our newsletters. It's on our social platforms. And watch this space, because there's going to be more of that as we go forward.
Excellent. Well, I mean, I have to say, last year was really good, and it was the first shot you guys had at doing it. So I'm really looking forward to seeing what this year's looks like with building on that experience. So as a last thing, I don't need any convincing about the NNNG. I think it's a great organisation, and the membership's so passionate about great nutritional care. But if someone listening isn't a member, what would be your elevator pitch for why they should join, and then how do they join?
So nutrition nursing is alive and well. Okay, that is a really important statement, because we're often perceived as a very discreet, quiet speciality, working behind the scenes, and we go in, we go out, and people aren't always aware of our presence. That, I think, is because we are the foundation and cornerstone. And if you think this time last year, when we were really in the eye of the pandemic, the early phases of that virus, there really was only nutrition and therapies that were maintaining some of those very critically unwell patients. And nutrition was profiled an awful lot last year across the webinars. And that was a great opportunity for the community to come together and for people to start to realise the significance of nutrition. There's often this blurred boundary and ambiguity between the dietitian and nutrition nurse, but they couldn't be more different in what we offer, of course. So I think that's important for clarity. As of an hour ago, we have just launched our brand new, fresh, innovative virtual website. There's a guide, so I'd really welcome people to go onto the website, National Nurses Nutrition Group, NNNG. You will see that in any search engine. Over you go, have a look. It's great. It's been a lot of work involved, but it's been so worth it. We've got a really good interactive discussion board, really easy to access. The membership allows you 12 months. It also allows you to sign up to BayPen, so free membership to that. You get quarterly newsletters. We have columns in clinical nutrition. You can sign up to that magazine for free. We've also signed up with the British Journal of Nursing 4 times a year. You will get a supplement with that, and you will also be given a subsidised rate for a yearly subscription. We offer a conference yearly, whether that's virtual or otherwise. And once you're into the site, you will get free guidelines, best practice, evidence, lots of information about education that's taking place across the country, courses that you can do. I don't think you're going to get much more for your membership, really. And what we've done, we've extended the membership. So now it's not just, it's acute, it's community, it's industry nursing. nursing homes, care homes, residential, learning disability, all the specialities that would use nutrition support.
Yeah.
And we've also now extended it to student nurses and nursing associates. So we're really trying to freshen up our image. Now, I asked the chair earlier before I came on what her thoughts were, and she said this is about taking the National Nurses Nutrition Group into the future, the next century. So we've got to modernise. We've done that. We've seen the benefits of the virtual world. I've talked a lot about Epic, and the NHS will all be moving towards that. That's what we've done with the NNNG today on that website. We've now got 2 social platforms, LinkedIn and Twitter. Really welcome our members to use it. It's not just about one bit of England. This is about we can communicate to the furthest point of Scotland, over to Ireland, Wales. We're bringing the whole community together in one area. And we also have an advertising space that we're going to be encouraging industry to use. So our members get to see very early on some of the latest innovations and developments.
That's fabulous. I shall look forward to seeing that, seeing as obviously we have one. So that's brilliant, Georgie. I mean, I have to say, I haven't had a chance to look at the website yet because it just went live. I will be doing that immediately. But, I think I'd say to people, I know the support and the that people get from the NNNG is fabulous as a community. So if people are thinking, should I join, shouldn't I would always encourage them to do so. So good luck with that. Hopefully you get some really good feedback. We're sort of out of time today, but thank you very much for joining us on the NG podcast. And hopefully we will see each other soon.
Thank you.